Alrighty, so we're beginning again. We're going to the book because in the live lectures, it looks like urinary and respiratory and a few others. Actually, I'll take a look-see. Gastrointestinal we already did, so that's a good one. You can go watch that one. That's straight from the PowerPoint. Urinary system and respiratory system both have only like 3 pages. So we're going to be doing those on this here, if I can find the bookshelf. There we go. Continue reading right here. We're going to go look for, if we can find it. The cat is also watching my video. Check this out. There's the cat right there. He's watching. There, he's watching the whole thing, and we can play with him. He's going to follow around the mouse. That's what he does, and he bothers me the entire time. Anyway, so that's what I get to deal with. So he's telling me more of this fresh new look. I don't care if it has a fresh new look. Let's go back and see if we can find part 2 body system terminology. Let's see if we can find, we're looking for urinary system. If we can find it in here, urinary system, there it is. Chapter 6 in the book. You can follow along this way. I'm just going to be basically going through the entire book without the darn cat here. Let's see if we can move this over. There we go. So we've got an entire system of stuff. Recognize the terms used for urinary system, of course, match word parts, word things like that, extra, cellulo, uro. So anything urology is the study of urology. Urologist is one who studies urology. That makes sense, right? Urinary system will include the kidneys, like we said before. Nice blood for, it's a beet juice and orange juice, actually. It's quite good. Composed of 2 kidneys, okay, which are these like bean-shaped things in the back. They're retroperitoneal, which means they're behind your peritoneum, which is in the back of the body. Now this here, they're like back in here. I'll show you on this guy. They're right in here, okay, around L1, L2 area right in there, and they're a little bit offset. So the one on the left is a little bit higher than the right, and there's a reason for that. If you can think why, let me know, and I'll tell you in a minute. But there's 2 ureters, which are the tubes that go from the kidneys, a place called the hilus, okay, which is in the pelvis, and they come down and they loop around to the bladder. They go to the back part of the bladder, which is in the pelvic cavity. The bladder itself is a muscular organ. It's obviously an empty organ, generally, unless it's filled with urine, and it has a trigone, which is a little triangle spot in there, and that's where the urine that has been filtered from the blood in the kidneys gets down to and fills up the bladder, and then the bladder gives you what's called the micturition reflex, which to micturate is to urinate, basically. And when that happens, there's a first and a second sphincter, just like in the digestive system. The first sphincter is involuntary, so it just tells you, oh my gosh, I have to pee. And then the next one is the one you usually have control over, unless you laugh or sneeze or something like that. So if we go through here, we have parenchyma. Remember, parenchyma and stroma are 2 words that work together. Parenchyma is actually the functional bits, and stroma is the structural bits. You kind of like think of like the functional stuff is the workers, and the stroma would be the walls and the desks and stuff like that. That's the structure. Okay. Urethra goes down to your urinary meatus. Meatus means opening. Okay. Down here, meatus, the trigone, we talked about that. Okay, so we have a good picture of the kidney right here. I don't know if I can blow that. Can I blow that up? I think I can. Let's see what I can do. Blow way up. Yeah. Okay, so I'm going to grow this up here as I'm recording. I'm trying to move everything around. So if we look in here, you can't really see my finger or I don't know how to do that. So we're going to have to look. So see the yellow part down the bottom? That's the ureter. And as that yellow part comes up into, it actually goes up this way if you're looking at the picture. So it goes up in there, and that goes into the renal pelvis, which is called the hilum, okay? And then there's those little triangle things that are dark. That's a medulla, okay? They're called pyramids, actually, because they're pyramidal shape. You have a vein and an artery and all that jazz. Retroperitoneal means that they're behind everything in the peritoneal space. So the guts are in the peritoneal cavity, and theirs are behind a retroperitoneal. Easy to injure, actually. They're very close to the surface too, which is very interesting. Nephron here we see is that's all of the blood goes through every 5 minutes. Okay, so you're every 5 minutes you're cycling through your entire blood that's in flow, and it's able to filter out. So it's able to filter out things like salts and if you need to acids and water and stuff like that that you don't need, maybe some certain electrolytes like calcium, magnesium, different salts and things like that. Now, if things get through that shouldn't be through, like sugar or blood or pus, those have different names, okay? So those different names are going to be um, like pyuria is pus in the urine. Hematuria is urine that has blood in it, and then um, what's glucoria is has glucose in the urine. Okay, so now the kidneys are lower on the right side than they are on the left. That's because the liver is in the way. I forgot to tell you almost. See. Now, once you get into the nephron, which is nephron, functional unit of the kidney, and you remember that by just every time, like remember mitochondria is the powerhouse of the cell, and nephron is the functional unit, right? Functional unit of the kidney. And inside there is called the glomerulus. Glomerulus. It's down here in the about three lines down in that paragraph. I'm trying to watch the cat who's walking by the front now. Urinary system exercises. Here we go. Other things we have: arterial, bladder. Bladder. Whenever you see it, bladder means open space, or systole, or vesiculo. Okay, that's open space. Calyx, cell, cortex, glomerulus, hilum, kidney, parenchyma. We talked about peritoneum. We talked about potassium. Now, look at potassium on this list, for example. When you see potassium, the symbol for it is K. It's a positive ion. It's actually the old word for it is kalium. And that's the new word is potassium. We just kept kalium. Renal pelvis, urine system, yada, yada, yada. He's looking at the thing again. Images. So here we have the kidneys at the top, the ureters, and the bladder. Very simple. We have the hilum, which is over on the right-hand side, going from the top. This is the medulla, and then we have the pyramids, the hilum, and then the ureter. And on the left side of this one, we have that's a renal pelvis, and then the calyx is what those are called. I just had a bunch of chili in my nose is completely opening up here. It's a good thing. So the polycystic kidney is on the right-hand side. It's terrible looking. Probably very painful. They had to take it out, obviously. Ureteral stones. We get stones as we go down. Hopefully the cat's laying on the keyboard, and hopefully he's not causing any trouble. La 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 la. Okay, there's barium. Pictures, wonderful pictures of an open bladder, which you don't need to see. I mean, you can look. So abscesses, albumin. Okay, so albuminuria has albumins or proteins in the urine. Leutemia contains excessive urea in the blood. So in the blood, you become septic. You become uremic, actually. Bacteriuria have bacteria in there. Glycosuria, there you go, glucosuria. This is good. So this you can run through. You can run through each one of these. Make sure your anuria means you're not urinating at all. Diuresis, condition of increased formation of excretion of urine. Okay, dysuria, painful urination. We don't like that. Okay, oligo, scanty urination. Oligo means scanty. Okay, we're just going to go through this one rather. Where's my glasses? Rather quickly. I don't want to spend too much time on these. I might do actually both of them because we're only at what 9 minutes in this one, and we're already halfway through almost. Colic. So interesting ones here as we come down through terms related to disorders. Diabetes insipidus versus mellitus. Okay. Antidiuretic hormone. Diuresis means to urinate, to get rid of water. Okay. To excrete a lot of polyuria. It's not good. It's generally polydipsia means to drink a lot, polyuria means to urinate a lot, polyphagia means to eat a lot. Here's the two different versions of the diabetes. Nephrolithiasis, we talked about that one before because we were talking about liths, okay, which are stones. Polycystic kidney disease, we saw a picture of that. Urinary tract infection, urolithiasis, and the urinary bladder. Okay, here it talks about Victor. Glomerulonephritis. So here we have the glomerulus, which is part of the kidney, the nephron, which is the functional part of the kidney. So this is very specific. Glomerulonephritis. This one here, what happened here? Glomerulonephritis, inflammation, so itis. Whenever you see itis, you'll know that it's inflammation every time. Osis is a condition of, okay, so the next one, hydronephrosis, dilation of the renal pelvis in one or both kidneys resulting in obstruction. So dilation usually means it opens up, but you're not able to filter water properly. Okay, nephropathy, nephrotosis, prolapse, or sagging of the kidney. That's a weird one. Nephrosclerosis, hardening. Sclerosis, sclerotic, all mean hardening. Pyelonephritis, renal hypertension. Cystitis, cystocele. Very good. Okay, this is good stuff. Okay, renal. Oh, the cat is hitting buttons. Sorry about that. Medical records. There's the kidneys. That's where they are. They are the color of urine. The color of urine. Okay, dark amber. We shouldn't have dark amber. We should have straw or light straw. Anything more than that, it means you're pretty dehydrated. You can have cloudiness. Of course, we don't like that either. Female cystourethrogram, a male urethrogram. Ouchie. There we go. You can check specific gravity urometer in there. These are good. This is good information here. You can go through and just get used to seeing all these stuff. A lot of it looks like it's repetitive. So this is also good because you'll see things like CT scan or MRI and stuff like that. Here you go. Here's a lithotripter. That's a cool one right there. Machine used to crush the stones. So what they use is shock waves, a sound wave, to crush the stones. They shatter them from the outside. So you in a bath of water and let those break up those stones in your kidneys. The urinary urostomy bag. This was therapeutic continuous ambulatory peritoneal dialysis. Oh, they go. They're going to clean everything, drain everything. Venous blood dialysis. Dialysis is something that happens when you have kind of later stages of kidney problems. Can be due to diabetes, of course, if it's uncontrolled. Some people don't know they have diabetes too, so it's always good to check those kind of things. Pharmacology. This is good. Oh my gosh, look at all these. So abbreviations. UTIs, we see that one. UA, urinary system, start from the bottom. Don't see specific gravity. You'll see pH. You'll see hemodialysis, possibly glomerulonephritis. Generally, you'll write those things out. DM is common for diabetes mellitus. Chronic kidney disease, CKD, it could be other stuff. We don't want to use that one. CAPD could be continuous ambulatory peritoneal dialysis. It could be confused with COPD. We don't want to do that. BUN is blood urea nitrogen. That has to do with your liver functions too. ADH, antidiuretic hormone. Most of them are pretty rarely used, but we do want to know, at least have an idea of those word shops pertaining to. Hey, cat. Don't be pressing stuff. So there we go. So this is translations. So this is all stuff that we would be doing in the, what's it called ourselves? Wow, I can't remember what I was talking about. Urology. There you go. So urinary system in the book is pretty good, easy to run through. There's a lot of words in there. So here's the best thing I think you can do for that is just take a piece of paper and write every single one of these words and a 3 to 5 word definition of them, and you'll know this hands down, inside and out and backwards. There's a lot of information in there, but I think this is a really good one to do. Let's see if we can go on to respiratory, since we're in the same thing here. Respiratory chapter 11. Why they're together, I don't know. Just because of the same week. Okay, respiratory system. I like the respiratory system. It's more interesting to me. Delivering oxygen of transport of cells to the body. What happened? So functions of the system. We always want to talk about functions because we're looking at physiology. Anatomy is actually where things are and how they work. So here we've got a delivering oxygen to the blood for transport to the cells of the body. You see right up there, those dots up there. Excreting the waste product of cellular respiration, carbon dioxide, good, filtering, cleansing. So filtering, okay, you use the nose hairs first. Cleansing, that's also going to be nose hairs and the mucous membranes of the nasal and oro and laryngopharynx, okay, and then humidifying, same thing. Warming, yes, same thing. The air getting into the lungs. It's very good to have humid air, actually. It'll help your sinuses as well. Helping to regulate the blood pH. Very important here. So the more you breathe out, the more you're getting rid of carbonic acid. Carbonic acid is a buildup of CO2 in the blood plasma. Production of speech and singing, sound for speech and singing. Oh, okay, that makes sense, right? Primary tissue is some blah, 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 blah. Okay, so use a stimulus for the sense of smell. These are great for this book. This is a really good, concise, really explains well, I think. Okay. Respiration has two parts. So there's inspiration to breathe in and expiration to breathe out. Think of those words to be inspired. Right? You go, that's what it is. That's inspiration, right? And expiration, and we die. It's expire, to expire, same kind of thing. Inhalation, exhalation, inspiration, expiration. There we go. Olfaction means to smell things as they are. Now here we have spiro, the second one in here, to breathe, spirometry, okay? Spiratory, pertaining to breathing. Expiration, oh, that's good. It has all of those things in here. Here's some functional stuff here. If we follow from the nasal cavity, we're going to have the nares, which are the nostrils here, and then you have the nasal concha inside. This is the nasal cavity, okay? As we come down the back end, see where the pink is straight back from our upper palate, you can see that's where the uvula would be. That will fold up when you swallow to keep things from coming up into the nasal cavity. As we go back from the oropharynx, okay, where it says pharynx there, into that white stuff, that's the larynx. The larynx is where your voice box is. That's the Adam's apple for males. With testosterone, it gets bigger. Our voices get deeper. That's the way it is. The trachea is about 20, I think it's right at 20 C-shaped pieces of hyaline cartilage all the way down to where it splits, which is called the carina. It actually has it on there. That's unusual. And you have a primary, secondary, and tertiary bronchi. The primary ones are right and left. If you look at these, you can see that the one on the right-hand side of the patient, okay? So that one goes straight down. So when you aspirate something, let's say your kid's playing around with a bunch of glitter or something, or little funny little things, and they breathe them in, it'll go down the right side more commonly than the left side. The reason is because it's a straight shot down. It has to bounce and go left to get to the left side. That's also because if you look at the left lung, it has 2 lobes. The right lung has 3 lobes. That's because the heart is more on the left side. Now we know that there, don't we? If we take a detailed look, they see the big circle towards the, what is that, the right side of this picture? Like, oh, right there. This picture right next to my head, okay? Right here. Okay. So this stuff, we have the pulmonary veins and arteries that come in there to the terminal bronchiole. So we have trachea, primary bronchi, secondary bronchi, which go to the lobes, and then tertiary bronchi, which go to parts of the lobe, the upper, middle, lower generally. And then you have the terminal bronchiole, terminal end, right? And then it goes to the alveolar ducts and the alveoli. The alveoli is the functional unit of the lung. Remember, we had the functional unit of the kidney, which is the nephron. We have the functional unit of life, which is the cell, that kind of thing. Okay, so just these are simple ones to remember. The alveolar sacs, if they break apart, that becomes emphysema. Okay, if they clog up, that can be COPD. So notice the capillaries and stuff. So what happens is, as you breathe in, there's a thing called partial pressure. So the air pressure we have is about 780 millimeters of mercury, right? That's how we measure it at sea level. So part of that is going to be oxygen. About 18% of it is going to be oxygen, and about 78% is going to be nitrogen. Nitrogen is completely neutral and doesn't do anything for you. The rest is going to be other gases, CO2, yada, yada, all this kind of stuff. So your body takes in based on the partial pressure. So you bring in a lot of oxygen. There's very little oxygen in the capillaries there. The oxygen will rush over to the capillaries through diffusion, okay? It's not facilitated diffusion. Remember that stuff? That's way back too for us, a couple weeks now. Pleura. Okay, so here in the pink and the red and the blue, it looks like we have different sizes of the lungs because the breathing, that motion, excuse me, the diaphragm, that's a respiratory thing to open up the lungs. Anyway, the pleura is the covering of the lung. So remember, we have that little plastic bag around the, imagine like a plastic wrap around the lung itself. That's the visceral pleura. And it loops around, okay, kind of centrally near the bronchi, and then it becomes the outer wall that the lung sits in. The lung sits there, and there's a whole container it sits in. That inside that wall is called the parietal pleura, right? So then inside that, in between the visceral pleura and the parietal pleura, is the parietal space. or the pleural space. You're going to pleurisy or pleuritis. That's where that happens. Those two tissues rub together and they'll make serous fluid. It's kind of that's a really cool thing. If it dries out, you get a pleural rub. It can be very painful. Respiratory tract, upper respiratory tract. So check this out. Here's upper respiratory tract goes from here, like basically the neck up. So lower respiratory. So upper respiratory infection would be coughing and sneezing. Lower would be mostly just coughing and wheezing, actually making wheezing sounds as opposed to sneezing. Nasal cavity, there we go again. We have there, see where the nasopharynx and the palatine tonsil up there, we can see the nasopharynx up high. That dangly thing, that's that uvula we've talked about. Larynx, the epiglottis. Epiglottis is the guardian of the airway. It closes down towards the back, towards the spine there, you can see, when the tongue pushes back to swallow. That keeps us from choking to death on everything that we eat. Well, that does happen. That's where we do CPR, right? You do the Heimlich maneuver. Which, interesting enough, he never had to do it. And I think he had to do it once after he had retired. He retired and helped somebody do the Heimlich maneuver, or had to be saved with the Heimlich maneuver himself, or something like that. It's a very interesting, interesting thing that happened to the guy. One of those weird things. Nasopharynx, you station. So if we go up here again to the picture, you can see, well, you don't really see it. Okay. Eustachian tube goes from the ear to the pharynx. So when you go like that, or you pull, you hear it like move around there, or when you have to do that when you're in an airplane, that's the eustachian tube you're opening up. Ears connect the throat to this point, equalize pressure in ears and throat. We do that especially when we're doing you have a squeeze, right? When you're scuba diving, you go down and there's too much pressure, you can blow a little bit and it'll go, you'll hear it. Lower respiratory tract, that's going to be the trachea. Let's see what they got here. Alveoli, we talked about all of that. Good. So we talked about those. So here we go. The nasopharynx, or the nasal cavity, would be the first one on this one. As we go down, we have that's the oral pharynx, and then larynx and laryngopharynx down here, the trachea. And we have that's going to be specifically the right primary bronchus. Okay, secondary is going to be the lobe of the lung. It's hard to tell, and that's the lower right lung and lower left lung. And then that shaded area, I suppose, is supposed to be the diaphragm, I guess. Oh yeah, diaphragm, okay. These ones too. Oh, easy peasy. Okay, so we have all of this stuff here. Should be good. As we go from the top, let's see. We'll do on the top in front of the nose, so anterior of the nasal cavity here. That's going to be the nasal cavity. The second one down will be the oral cavity. The third one down, it looks like that is going to be the lingual tonsil. A little tiny thing, hard to see, you got to be careful. And then the next area here is the larynx, and then you have the epiglottis and the, what's that going to be, just the larynx, I guess. On the opposite side in the back, we have, let's do from the bottom up, we're going to have the trachea, and then we're going to have the, like this is esophagus, do they have that on there? Or are they pointing to the epiglottis? That's a hard one to tell. I'm not sure what they're talking about. That's the oral pharynx, or the laryngopharynx is that area, really. And then the next one up, oh, come on, cat. Bruh. Ah, cat. Let's look up here and see what we got. You can go back, see? There you go. Oh, okay, so there's taking palatine tonsil, oral pharynx, laryngopharynx. There they go. So they have the pharynxes back here, and the pharyngeal tonsil and the paranasal sinus. It's not paranasal sinus. That's actually the sphenoid sinus. So here's a kind of a cool thing. If we're looking at this one here, if you see that, let's go back up to this picture. Sorry about that. So you see the paranasal sinus, which doesn't mean around the sinuses, but this is the sphenoidal sinus. If this little place right behind a little like divot in there, gosh, I wish I could hang on, I'll blow myself up here. No, blow myself up. Hang on a second. Cat, you can't be on this stuff. You can't lay on the. He messed up the thing. Ugh. Okay, come over here. Hang on. Like this. We're gonna go over here. Watch out, cat. Okay, so right there. Okay, that's called the sella turcica. Wait. Hopefully this is still working. I disappeared. Oh well, this is the cat doing this stuff. Anyway, shucks. Cat, you ruined me, man. All right. Well, we're still recording, so I'm still going. Let's go down and see what else we have in here. Oh, so club finger, and there we go, some cyanosis. So cyanosis means bluing, and you're going to see that in the, oh, you can see, can you see it there? Maybe, I don't know. You see bluing of the extremities. You can see it on the fingertips. You can see it on the lips, and that's not a good thing. That means you've reduced your oxygen intake, right? Here we go. These are really good, man. This tells you all of the stuff here. Tachypnea, orthopnea, okay? People with cardiac problems will have orthopnea, okay, orthopnea. Hyperpnea, which means increased level or more breathing than you should have. Where the heck did I go? Sorry about that. I'm just trying to move things around. And where the heck did my image? No, not image. No. You totally killed me, cat. All right. Well, the cat totally got rid of me. Let's see if I can. That's what they do. Okay. Are we on there? No. Discard. Well, screw it. Okay, hey, there's the rest of my, man. Okay, hang on, let me see if I can fix this real quick. I can't live video. Ah, there we go. Save. Oh, geez. Cat, you totally messed everything up. So I screwed up my green screen. Oh well, we're gonna keep going. I'm just gonna shrink myself down here. Ah, there we go. I'm gonna put this down like this, and like this. Good enough. Damn cat. See what cats do? Oh, there we go. Epiglottis is red and swollen. Nodules, okay, so there they are right there, the papilloid nodules. That's from oversinging. So Adele had that. Had to have surgery for that. Mucus, blah, blah, blah. Go through these. Okay, it's not bad. So we've done two carcinoma, different carcinomas. Very good. Okay. So again, go through this stuff here. Some other interesting words. Arterial blood gas. You guys will be taking that. If any of you decide to go into respiratory therapy, you'll be definitely taking people's respiratory or arterial blood gas. You have to take arterial blood, and they measure the amount of oxygen that your body is transporting. Bronchoscopy, looking down the side. You don't do that when you're awake. Okay, chest X-rays, you can do those when you're awake. Lung perfusion scans, MRI, peak flow meters. You can buy a peak flow meter or a spirometer. Stethoscope, that's what you listen with. That's the thing with the two, right? You listen to someone's heart. Okay, so look at this sweat test here. Means of diagnosing CF is cystic fibrosis. Cystic fibrosis is where their lungs become eventually fibrous, right? And they can't breathe and they die. Now, it's really well managed with diet these days as opposed to medication. Let's see what else we have in here. Oh, you're going to see different kinds of masks. Oxygen therapy, simple face masks, rebreather, and positive airway pressure. So, a Venturi mask. A Venturi mask, notice, will usually have the whole big thing there. You can actually add like a nebulizer to it, whereas a simple face mask is usually kind of like a rebreather, or yeah, it's a simple face mask. That's called a Venturi mask, nasal cannula, continuous positive airway pressure, like a CPAP. That's what they were using basically on people who had COVID. Oh, tracheotomies and tracheostomies. How much fun is that, septoplasty? Very good. I'm just scrolling through, guys. I mean, you guys can do these as you need to. Go through some of them. Difficulty breathing. Let's go through here. Dyspnea is difficulty breathing. Rapid breathing is tachypnea. Abnormal is silicosis usually. Listen, I don't know. I have to look it up right now. Discharge from the nose is rhinorrhea. Process of breathing out expiration. Pus in the chest. Pio, oh, I gotta look that one up in the chest. Inflammation of pleuritis, surgical repair of the nose, rhinoplasty, incision, and that's a tracheotomy. Ostomy, os makes a hole. Fungus. Ew. Yeah, very cool. Lots of these. So here you go. Here's the list right here. If you go through and just get all of these done and just look at the words and get used to the words, get used to saying them is more important because the more you use them, the more you'll be able to use them. All that kind of stuff. So anyway, that is it for these two. This is week 4. This is part 2 of week 4, part 2 and 3. But those two lectures in there, the what's it called? The PowerPoints only had 3 slides each. So I don't know what was going on with that. I went ahead and just made this for you. Good luck, have fun, do your homework. Let me know if you need anything on Canvas. Remember, this is for Fortis online stuff, and watch the other videos. They'll show up right up here and right up there, and or actually, I think up here will show like to subscribe if you want to subscribe, and then over here will be the other things. Now, I've done other ones too. You might want to go through the anatomy and physiology playlist and see if there's anything else we're missing. For week 6, it's reproductive. I already did those ones. I didn't do it specifically for terminology. I did it for anatomy and physiology, but the same thing. You just receive all the same information. So I'll be doing a couple more of these as the days go on. Hope you guys are doing well. Talk to you soon. Take care. Good luck and goodbye.